Which of the following histological findings is most likely to be present in this lesion? Chondroid stroma, ductal cells with cribiform pattern, glandular elements with mucinous cells, and oncocytic epithelial cells or squamoid cells. So this is a 50-year-old woman presenting to her primary care physician with a painless, slowly enlarging mass in her left parotid gland for the past 4 months. She has a 20-year history of smoking but quit 2 years ago. On exam, the mass is located in the tail of the parotid gland and is non-tender. A fine needle aspiration is performed, and the pathology report shows a cystic lesion with epithelial cells and an abundant lymphoid tissue. So I can never remember slash pronounce the name of this tumor, but it's the one that has the epithelial cells and the chondroid stroma. So I'm
Hmm.
chondroid stroma. I can't remember the name of it, but I know exactly what I'm thinking. Oh, no, I don't know what I'm thinking of.
So this should actually be a Warthin's tumor.
Okay.
Okay. Warthin's tumor usually, right? This, I mean, this is an ENT question, right? Papillary cyst adenoma lymphomatosum. This is kind of the real name of it. Warthin obviously is probably by Dr. Warthin that kind of figured it out, right? But they're associated with smoking, right? They have a prominent lymphoid stroma, right? But they have oncocytic epithelial cells. So you're going to see that in kind of this, papillary or finger-like projection with cyst adenoma and then, lymphoid tissue. So that kind of fits, all of Warthin's, right? But pleomorphic adenoma is what you're thinking about, right? With the chondroid stroma, right? Most common benign salivary glands, usually painless, slow growing in the parotid, but usually it's a mix of epithelial and myoepithelial cells within a chondroid or myxoid stroma. So those are kind of what you're thinking about. Yeah, so pleomorphic is kind of pleomorphic adenoma. It's benign, and then for Warthin's, you have some oncocytic epithelial cells. So we get tested on that on our boards. So
So for the pleomorphic adenoma, is smoking not a risk factor?
not too much. It can kind of occur anywhere. Smoking is really closely related to Warthin's tumor. Just kind of remember that Warthin's and smoking is going to be kind of your main thing. So
That's why I asked. 'Cause, like making sure I get my associations right.
yep.